Welcome to Healthcare Authority's presentation on Apple Health and the Public Health Emergency Unwind, Part 2. For today's presentation, the following topics will be on Part 1 Webinar Overview, Post Eligibility Reviews, Apple Health Medicaid Program Reminders. We will provide 12 scenarios for you to review, how to apply for Apple Health, and finally, resources. Part 1 Webinar Overview. In case you missed it, our webinar on the Public Health Emergency Part 1 has been posted on Healthcare Authority's Stakeholder and Education webpage. Topics discussed during Part 1 were an overview background on the public health emergency, Apple Health renewals in general, renewals through the Washington Health Plan Finder, the Department of Social and Health Service renewals, outreach, how to apply for Apple Health, and resources. Again, the slides and recording is available at hca.wa.gov/stakeholder-training. Post Eligibility Reviews. What is a Post Eligibility Review, or PER? PER is the verification process completed by healthcare authority staff when the attestation of income is not compatible with information obtained through cross-matches, and the cross-match shows the individual may not be eligible. Eligibility for MAGI-based Apple Health is based on self-attestation, which is accepted at the time of application or renewal. Income described as not compatible with federal and state cross-matches is when the income an individual attested to is below the Apple Health standard, but the data sources show the income is above the Apple Health standard, or the data sources are not available. When Healthcare Authority is unable to verify income with third-party sources, a letter will be sent to the primary applicant requesting at least 60 days of income verification. This letter is sent to only the primary applicant and any authorized representative who have permission to receive letters on the applicant's behalf. Post-eligibility reviews for modified adjusted gross income MAGI individuals will resume April 1st. Individuals may have a PER if they apply or renew on or after April 1st and the information attested to is not compatible with the data sources. The Washington Health Plan Finder will send out a newly designed PER notice requesting individuals to verify income and deductions. Apple Health may terminate if an individual does not respond to a PER. Here is a sample of the Apple Health Request for Information Letter, or EE005. When individuals receive this letter, it is an indication that information is being requested in order to determine eligibility. If the information is not received, determination of eligibility cannot be made, and therefore the individual may be terminated from coverage. Individuals are given 15 days to provide the requested information. They can provide this information via email, fax, mail, and online. It can also be done if the individual has created an account and by signing in and updating the requested documents to their document center. During a PER, Healthcare Authority staff check the available third-party sources to verify the individual's self-attested information. Third-party sources may include the Employment Security Department, If staff is not able to verify third-party sources, they will follow up and request the information. After the requested information is due, staff will check back to see if the information was received, and from there, determine the type of program the individual may qualify for, including a premium-based program. If the information requested is not provided, or the information puts the individual above the income standard, their Apple Health coverage will terminate. If an individual finds that their coverage closes, they have the option to reapply for Apple Health, but if they self-attest to what is different from what was verified through the data sources, their coverage will be placed in a pending status and will remain pending until the individual provides the information needed to determine eligibility. As a follow-up, the Washington Health Plan Finder will send an important deadline to submit information letter asking the individual to provide proof of income and deductions. The Healthcare Authority staff will check back after the due date to complete the process of the application. This is a sample of a letter requesting information following a person reapplying for Apple Health. The table displays what is needed for the verification purposes. This is a second page of that same letter requesting information. It provides examples of the different types of verification an individual can submit. Apple Health Program reminders. Premium requirements for the Apple Health for Workers with Disabilities, HWD, and Apple Health for Kids with Premium, CHIP, resume in July of 2023. Individuals active on either program will have to start paying their premiums. Those who are American Indian or Alaska Native do not have a premium requirement. As a reminder, terminations of coverage occur after 3 months of non-payment for CHIP and 4 months of non-payment for HWD. As a refresher, the Apple Health for Workers with Disabilities allows working individuals with disabilities to purchase medical coverage by paying a monthly premium. The premium amount is based on their income, and those who qualify for this program are individuals who meet federal disability requirements and are employed either full or part-time. This includes self-employment. For more information about this program, we have linked the flyer on this slide. As a reminder for those who are on the HWD program, this postcard will be mailed to that population about premiums to resume. The postcard will be mailed on June 1st. It will provide information such as a phone number to call and to watch for a billing notice for when their premium is due. The first premium payment due was on April 15th. Also, as a reminder for those who are on the CHIP coverage program, on May 15th, a postcard will be mailed also letting them know that the premiums will restart. The first payment due is July 15th. The postcard will have information where individuals can log in at Washington Health Plan Finder, or a phone number will be listed to call and report a change or renew coverage. For individuals who during the PHE turned 65 or became eligible for Medicare, they will receive a letter letting them know they need to complete a renewal to determine what coverage they may qualify for. They will have an option to apply through the Department of Social and Health Services for a classic Apple Health program, or if an individual loses Medicaid on or after January 1st of 2023 and they qualify for Medicare, their special enrollment period starts the day they're notified Medicaid is ending and ends 6 months after Medicaid coverage ends. A special frequent answers to question will also be mailed out to those individuals for more information. For those who receive income from Social Security, they may qualify for help with their Medicare premiums. The Medicare Savings Program can help with paying their premiums or deductibles and copayments. To qualify, an individual must have or be eligible for Medicare Part A and have income below a certain threshold. And as of January 1st, 2023, there are no resource limits for this program. If an individual is on an Apple Health program and pregnant, they can receive 12 extra months of coverage after the end of their pregnancy. This is an automatic transition as long as they report their pregnancy with an estimated due date. For those who are not on an Apple Health program who had a recent pregnancy can still apply for this coverage called after pregnancy coverage as long as they apply within 12 months of their pregnancy end date and meet the income guidelines. For more information on the eligibility requirements, they can go to hca.wa.gov/APC. AEM is a program for individuals who do not meet citizenship or immigration status requirements, or for qualified individuals who have not met the 5-year bar and who have a qualifying medical emergency that is covered under the AEM program, such as emergency room care, inpatient admission, or outpatient surgery, cancer treatment, dialysis treatment, anti-rejection medication for a post-organ transplant, or for a COVID-19 testing or treatment. We want to stress that it is safe for anyone to apply for healthcare coverage. Immigration information is not shared with Immigration and Customs Enforcement. For more information, we have the link on the AEM process on the slide. Here is a list of the types of supporting medical documents that are required based on the type of emergent condition. Scenarios. Manual is on Apple Health for adults with a review end date of May 31st. Washington Health Plan Finder attempts to automatically renew his coverage in early April. The Washington Health Plan Finder checks electronic data sources which show income is reasonably compatible for Apple Health eligibility. The automatic renewal process was successful. Manual has Apple Health coverage for another year and will receive a Washington Apple Health renewal review-only notice. Scenario 2. Lena is on Apple Health for adults with a renewal end date of May 31st. Washington Health Plan Finder was not able to automatically renew her coverage in early April. Therefore, Lena receives a response-required Apple Health renewal notice and must take action to renew her coverage. She responds by completing her renewal using the WaPlan Finder mobile application. She reports income that is under the limit and is renewed for another year. Lena may have to respond to a Post Eligibility Review letter by providing proof of income and deductions. Scenario 3. Ahmed became Medicare eligible during the PHE and moved to a classic Apple Health program with the Department of Social and Health Services. He is approved through May 31st. DSHS mails him an eligibility review notice on April 12th, which he submits through Washington Connection. After a DSHS staff process the eligibility review, his coverage remains the same. His renewal date is May of 2024. Scenario 4. Danae is on Classic Apple Health with the Department of Social and Health Services with a review date of July 31st. She turned 65 years old during the PHE and was approved on SSI-related Apple Health with the Department of Social and Health Services. After receiving her eligibility review form in the mail, Danae completes her review through the Washington Connection. She reports working part-time at a pet store and receiving Social Security retirement. DSHS staff approve her for the medically needy spend down. The HWD staff will reach out to her about enrolling in HWD since she is working. Scenario 5. Hugo is on a Medicare Savings Program with a review end date of June 30th. On May 5th, DSHS staff review his case. His only income reported is Social Security of $850 a month. Does Hugo need to report his assets resources to DSHS? No. Hugo does not need to provide resources to DSHS because as of January 2023, there is no longer an asset or resource test for MSP. So DSHS staff renew his MSP through June 30th of 2024. Scenario 6. On May 1st, Jess renews their Apple Health for Adults through April 30th. Their self-attested income with Amazon is not reasonably compatible with data sources. On May 15th, the Healthcare Authority staff conduct a PER. They verify Jess' income using the wage stubs uploaded to the Washington Health Plan Finder Document Center, and Jess remains eligible for Apple Health. Scenario 7. Rose completes her Apple Health renewal and attests to income at $500 a month from her job, but the cross-match with Employment Security Department shows it to be $1,200 a month. No PER is needed because the cross-match completed with the data sources find income is still below the Apple Health income standard. Therefore, Rose remains on Apple Health. Scenario 8. Jake reports his income is $1,400 a month from his job, but the ESD cross-match shows income to be $2,500 a month. The Healthcare Authority staff conduct a PER using the wage stubs Jake provided through email, which shows his income is over the Apple Health standard. Jake's Apple Health coverage ends, and he enrolls in a qualified health plan. Scenario 9. On August 23, 2023, Yevgenia reports in Washington Health Plan Finder that her pregnancy ended a year ago on July 10, 2022, and that she is not currently pregnant. Apple Health after pregnancy coverage ends August 30, 2023, and based on her current income, her coverage changes to Apple Health for Adults effective September 1, 2023. Scenario 10. Katie is receiving cancer treatment and she was approved for AEM through December of 2022. Her coverage has been extended and her new review end date is June 2023. In May of 2023, the Washington Health Plan Finder attempts to automatically renew Katie's coverage, and she is sent an information request letter regarding AEM medical evidence. Does Katie need to submit current cancer treatment notes to maintain her Apple Health coverage? Yes, Katie needs to take action. She submits her current cancer treatment notes, which are reviewed by the Healthcare Authority clinical staff. Her AEM coverage is approved. Scenario 11. Stu is 72 years old and needs dialysis, but he does not have insurance. His friend Sally told him about the AEM program, but he does not know where to apply. Where does Stu apply for AEM? Since Stu is over the age of 65 years old, he should apply for AEM with the Department of Social and Health Services. Stu receives a request letter for supporting medical evidences, which he takes to his dialysis center. The dialysis center faxes the current flowcharts to DSHS. After a clinical review, Stu is approved for AEM and receives dialysis treatment. Scenario 12. Min turns 65 in June of 2022 and has been enrolled in Apple Health for Adults since May of 2020. His current renewal date is July 2023. In June, he receives a special FAQ notice sent from the Washington Health Plan Finder that provides information on how to apply for other coverage. Min applies for Classic Apple Health through the Washington Connection, but needs help with his Medicare application. Min uses the information on the FAQ notice to call Sheba for help with Medicare. They tell him he can sign up for Medicare now through February of 2024. How to apply for Apple Health. Adults age 19 to 64, children, parents and caretakers, pregnant individuals, or those whose pregnancy ended within 12 months or for the AEM program can apply online through the Washington Health Plan Finder, download a mobile app, WA Plan Finder, call the Washington Health Plan Finder Customer Support Center, submit a paper application, or at no additional cost, in person, reach out to a navigator to help apply for Apple Health coverage. Individuals age 65 or older who have a blindness or a disability or need long-term services and supports should apply for Classic Apple Health through the Washington Connection online, or they can submit a paper application. They can call and request an application by calling, or they can go in person to a local community services office. Resources. Here is a list of resources. We have an email address for you to reach out to in regards to the PHE Unwind. We have a webpage dedicated to the PHE, an Apple Health Guide to Unwinding, the PHE Communications Toolkit, and Healthcare Authorities reference guides. For more information on how to qualify for Apple Health for pregnant individuals, we have a link listed here, as well as for those who are interested in applying for the After Pregnancy Coverage Program. If you would like the social media toolkit sent to you, we have the email address listed, and for other slides, webinars, or information on other Apple Health programs, we have listed our Healthcare Authority Stakeholder Training and Education page. And for a list of Apple Health policy reps throughout the state, the link is provided here. To reach out to the statewide Health Insurance Benefits Advisors, SHEBA, we have their website and phone number listed. For information about Medicare and their special enrollment period, we have provided a link, as well as a link to the Medicare Savings Program webpage and flyer. Thank you.